requires post-secondary schools to find clinical placements for students that exempt them from vaccinations requirements if the student requests.
Here we go again. Maybe.
So, do either senator, I've got Senator Green and Senator Winkler here to evaluate this bill. Do you have any
Like to
opening?
just listen.
Okay. Okay. All right, we'll go ahead and start then. Um, I'll start behind me here. We'll work around the room and then we'll take those online if they wish to comment. So go ahead.
Do any more of those are we good?
Okay. All right. That might be best.
Thank you. Sorry. My name is Heather Ryan. I'm with the organization Bitches Get Stuff Done. We are registered against this legislation because the verbiage of it makes it look like if you're a doctor candidate, you can actually forego your vaccinations, which is peculiar. I would think that doctors are pro-science, like most of America, and they would want their vaccinations so that they're not infecting their patients. Thank you.
Thank you. Lindsay Mayer with Informed Choice Iowa. We are an advocacy organization focused on protecting parental rights, informed consent, and medical choice. And we thank you, Senator Salmon, for bringing this bill forward and continuing the conversation from the House that we started last year. For years, we have heard repeated concerns about the shortage of healthcare workers, from nurses to physicians. Yet one of the most significant barriers to entering this profession has gone largely unaddressed. Many individuals who might otherwise pursue careers in healthcare are deterred by mandatory vaccination requirements that leave little room for personal, medical, or religious considerations. Allowing those who work in healthcare to decide what is best for their own bodies or to act in accordance with sincerely held religious beliefs is an important and necessary first step. Blanket vaccine mandates, particularly for products that are shielded from liability, undermine personal autonomy and informed consent. Every product carries inherent risks, and every individual should retain the right to accept or reject those risks for any reason. No person should be coerced into a medical intervention as a condition of education or employment. Furthermore, many individuals' religious beliefs include principles against defiling the body, and denying students the ability to claim exemptions constitutes religious discrimination. The topic of healthcare clinical issues continues to be one of the top things we receive messages about year after year. From public community colleges to private colleges, Regents university programs, and everything in between, we have heard from them all and have counseled parents and students on how to defend their religious rights. Many of you have heard from them via email, and some are on Zoom today. By passing this bill, Iowa will be respecting individual choice and religious freedom. It will remove unnecessary barriers to education and employment. Let's support students with strong convictions so they can complete their education and help build a strong, capable, and compassionate healthcare workforce for the future. Thank you.
I'm sorry, I didn't get your name.
Lindsay Maher with Informed Choice Iowa.
Thank you.
You're welcome.
Hi, I'm Bree Johnson, and I'm here speaking in support of this bill as well. There are many higher education institutions that make accommodations. If there is a student who has certain needs, healthcare needs, and they just don't agree with them morally, ethically, religiously, higher educations should be making those accommodations. Furthermore, it'd be no different. Yes.
I hear the Zoom cannot hear or see us.
The microphone's on, right? It's going to be out.
The audio should be on.
Hmm.
Your audio's muted right now.
Say something? or-
Yep, that's good.
Yeah.
Thank you.
Test?
Can you hear?
Everybody can hear? Okay, thank you. So really all this bill would do is open up opportunities. There are students with specific health needs or requests, and there are placement options willing to take on those participants. And the work would really be no different than any other higher learning institution that helps place internships for graduates to get the appropriate post-grad experience. Thank you.
Thank you.
Anybody else?
Thank you, Madam Chair. Doug Strike here on behalf of the American Physical Therapy Association, their Iowa chapter. We're currently registered undecided on the bill. We have a significant number of our members who are involved in the education arena, working in our colleges and universities across state, training physical therapists. We're registered undecided. We have concerns that there's a finite number of sites that are willing to take individuals who want to exercise their right not to have given vaccines. The way the bill is worded, if we run out of sites, there is a significant hammer as far as the loss of funding from the state. We can't force folks to take individuals. We need those clinical sites. We're worried that we would lose clinical sites or not have sufficient clinical sites to meet the needs of these students who are requesting it. So the bill puts us in a difficult position there. Thank you, Madam Chair.
Thank you. Frank Scheider with the private colleges. We're registered undecided. We do have some concerns, and the concerns are clinical placements of our students and the fact that we don't control those placements. The entities that provide those placements are the ones that set the rules and the regulations, guided by federal law. So our concern would be making it harder to have clinical placements for our students. And it's already really, really difficult right now to find those placements. So we'd be concerned, and we're having discussions on how this would work and how we could make sure that our kids had opportunities to get this educational need through these clinical placements and not limit those placements. Thank you.
Good morning, Teresa Harms here, representing Des Moines University, the Occupational Therapy Association, and the Speech Language Hearing Professionals. All registered is monitoring this legislation right now. I would echo the comments from my two previous colleagues here, Frank and Doug. Des Moines University educates the most, consistently is educating the most family practice physicians across the country here, and the biggest challenge that we have is clinical rotation placements. And right now, they're one of the largest occupational therapy programs in the state. And so the biggest challenge is finding placement for these folks. And then it is out of our hands on whether or not the placement locations are willing to accept them. And there's a lot of different factors that play into that, including, you're working with critical individuals who have high health risks, and so they have to be able to make a decision on whether or not those are folks that can otherwise be exposed to somebody that could potentially expose them to something that it can be spread. So it's just understanding and knowing that. We try really hard to work with all of our students, whatever their requested needs are. But again, it's not always up to us on those clinical rotations. And if we can't find those placements for those students, then it puts us in a predicament. And as Doug said, that there's some significant consequences for the institutions like ours that are working hard to do that, but not being able to find the accommodations for those students. Thank you.
Okay.
You got a couple hands up there.
Okay. So we'll go ahead with the folks online. Holly, would you like to speak?
Yes, good morning. My name is Holly Baumgartel, and I'm a parent of a nursing student at DMAC. Her name is Peyton. She's a sophomore. She has finished all of her prereqs to become a nursing student. She got her CNA this past fall, which was a challenge because the school told us that we could not move forward getting her CNA because she was not vaccinated. She's had a religious exemption her entire school career, and we've never had a problem. She went to school in Norwalk, and then high school at Roosevelt, and we've never had a problem with religious exemption. Even her first year of college, no issues, but getting into the nursing program, they will not allow her to move forward unless she is fully vaccinated. She was able to finish her CNA, um, even though they told her she couldn't because we called the clinical site and they said that they did not require full vaccination and it was no problem for her to be there. So we're kind of at a standstill on what to do with her because she's got all of her classwork done, but she can't move forward. Even though there's a nursing shortage, it's kind of disappointing that this is holding us up.
Okay, thank you. The next, Dan.
Oh, I think I'm
Oliver?
unmuted.
Oh,
Yeah.
okay. All right, Oliver, go ahead.
Okay. Chair and members of the committee, thank you for the opportunity to speak today. My name is Oliver Bardwell, and I'm here with Islands for Freedom. We've been standing for medical freedom since COVID, and this bill speaks directly to the future of Iowa's healthcare and workforce. Many of us have children who want to enter the medical field. My own daughter will be in nursing school soon. These are young people who want to serve, heal, and care for Iowans, not be forced into medical decisions under the threat of losing their education. We all watched what happened during COVID. What was called safe and effective effectively became, by many accounts, ineffective and unsafe. Mandates were imposed without transparency, long-term data, or meaningful consent. Now those same policies are creating artificial barriers for students. And I've heard here that concerns about it may be difficult to find clinical placements that allow exemptions, and respectfully, administrative inconvenience is not a justification for denying students choice. Iowa already has a wide range of clinical sites, rural clinics, long-term care facilities, outpatient centers, and private practices. Students already manage complex placement logistics every semester. This is not impossible. It simply requires prioritizing students' access over bureaucratic inconvenience. SF 2095 does not ban vaccines. It does not dictate hospital policy. It simply ensures students are not trapped in mandate-only pipelines that block graduation. If we want more nurses, more healthcare workers, and stronger access to care across Iowa, we should be removing barriers, not reinforcing them. I strongly urge you to support SF 2095. Thank you.
Okay, thank you. Dan? Dan Tweetmeyer?
Tweetmeyer, can you hear me?
Yeah. Yes.
Okay. Just a couple quick comments. I testified last year and still in support of this bill. I'm glad that I think last year just addressed the COVID shot. I think it's great that it's addressing any vaccine. I agree with previous comments regarding, I just jumped in kind of late here, and we're trying to, I guess, cater to the clinics. We're looking for agency. We thought we had that with religious exemptions. We thought that we had that with medical exemptions. And my daughter is a graduate of Northwestern College. Her ceremony was 2 years ago. Jeff Shipley filed a civil rights complaint against that school. When I went to her graduation, I'm reading directly from the program, that Northwestern College was founded by a migration of Dutch Calvinists in the 19th century, brought immigrants wanting religious freedom and a better life to the fertile farmland of northwestern Iowa. And a student there was denied religious freedom, religious exemption from that same school. She was denied graduation because she was denied clinical experience because of this very issue over a flu shot. So the clinics are the ones that need to adjust, and we need to stand for the rights of these students to obtain a degree. I also have a niece who chose a different profession, and there's many, many like her, men and women, that choose not to go into healthcare when we have a critical shortage for these workers. So I am so glad that you are taking this issue, and I am excited that this is the year that it will go past subcommittee, it will go past full committee, and it will go to the floor and end up on the governor's desk, signed and into the law, so that we can move past this. Thank you so much.
Thank you. Um, Gabby? Can you hear me? Gabby?
Yep, I just got unmuted.
Okay.
My name is Gabby Thistler. I am a concerned citizen. A parent did email the subcommittee and they reached out to me to ask if I would read part of their email as they do want to remain confidential for their daughter is in fear of retaliation. If this would come out that they were the ones that were stating this, but I just wanted to read a portion of her email that she is a nursing student right now. She was given a list of vaccines that she was needed prior to beginning the clinicals. She was vaccinated as a child and up to date, but did not want to receive the flu or COVID shot. She was allowed a religious exemption for the COVID shot, but was told absolutely not on the flu shot. She said they were told that it was required by the clinical sites, so the daughter called the hospitals that she would be doing her clinical hours at and discovered that that was not true, that several of these allowed an exemption to the flu shot. This was follow-up work that the student did calling the hospitals directly. So instead of saying, let me verify if the sites will require those, the student just was told, no, you have to get the vaccinations. And so even though we heard earlier that the clinicals sites might not be able to place them. This student took it upon herself to go and ask those places for the exemption and was told it was okay, and it was the college telling her that this was not allowed. So we do have many students and parents that are definitely fighting for their children to be able to get into the nursing industry, like it was mentioned, we have a shortage of. And so I just urge you to pass this bill. Thank you.
Thank you. Um, Anyone else? I don't see any of the raised hand. I did see Jennifer Harbison with a raised hand earlier, but don't see it now. Okay, I think we may be done then with taking testimony. Senators, do you all want to make comments or have any comments?
I will. Thank you. So one of the things that I think about the code that you are writing this, utilizing is the communicable and infectious diseases that would be actually in health and human services, not necessarily in education. Writing code into an area that does not directly relate to education institutions, I think is interesting because I feel that it is not necessarily about the school, it is about where they can do clinic, and that would be a decision in regard to potentially HHS. And so that concerns me, but I do have, the other thing is that Iowa Tuition Grant is a need-based grant. And students apply and are given the opportunity to accept that grant. It is not based on career, it is based on need. And to eliminate all need-based grants for an institution seems certainly an overreach in regard to the situation. They cannot necessarily solve the placement issue. And I think that this particular bill is targeting the wrong direction if you want to be able to practice. The other thing, though, that I think about trying to put on the hat of somebody who is working in the communicable diseases, I'm wondering what the liability of a facility would be if they allowed an unvaccinated individual to have regular contact with patients. Generally, there's kind of the oath in the medical field to do no harm, and I think that concerns me. But this isn't necessarily the committee that could potentially do with that or deal with that. Would the exemption affect their accreditation? I don't have that information, and this committee probably isn't eligible to do that. And then on page 2, it says that they must, starting on line 13, the school offering a degree program requiring a clinical rotation shall, upon request, identify a clinical rotation placement. And my question would be, if they attempt that and there is not one available, the recourse, I'm not sure the recourse is necessarily on the student or the institution. It might be the recourse on the healthcare facility. And then in that kind of a situation, they are making decisions about the kinds of vaccinations. A facility is making a decision about the kind of vaccinations that are necessary in order to practice, and there's a wide variety of facilities in the definition. It can be healthcare hospitals or other licensed inpatient centers, ambulatory, surgical, or treatment centers, skilled nursing centers, residential treatment centers, diagnostic, laboratory, and imaging centers, and rehabilitation and other therapeutic health settings. So there might be some alternatives, but not necessarily with the relationship of the teaching institution. And again, these are all questions that really belong in Health and Human Services, not necessarily here. But I do have one question, if Senator Salmon would yield for a question.
Okay.
And the question is, why did you amend eligible institution? Why did you change the definition of eligible institution in this bill?
I don't know. I don't know that it was changed.
It's on line 30 of page, what I call it the second page, line 30 of the second page, where you've struck and made it or is a school of barbering and cosmetology. I don't know the rationale. And then on line 31, and is accredited, you mark, it's crossed off and accredited. I just didn't know why that the eligible institution definition was changed.
Okay, I didn't know that it was changed.
Then the other thing, Iowa tuition grant is only for our private schools and colleges, universities and colleges. And so targeting just one school setting, one educational organization, I'll use that as a terminology, is interesting that is the target, and eliminating higher education or community colleges in general. So I have several problems with this particular bill, more logistical problems. Certainly an individual does have a right to make a decision about vaccinations, but I do wonder what liability that would place on an institution, and how patients would feel knowing that that kind of an exemption was given to someone that is caring for them that might be in a critical health situation. But I suggest that this get referred to Health and Human Services, not my job, though. Thank you.
Go ahead. Senator Green, yes.
Thank you, Senator Sam. Doug Strike. So this is kind of in your wheelhouse. I was curious on the question that Senator Winkler brought up about risking their accreditation status and stuff. Do you have any comments on that?
The institution risking their
Risking countersuits, lawsuits, if somebody gets sick because of unvaccinated person, and then, which is what she brought up, would risk your accreditation
I'd
status.
have to defer to the institutions on that. I represent the physical therapists actually themselves, not the institutions.
Okay. I just saw as an attorney, you would.
Okay. Have not researched that. I apologize.
That's all right. Thank you. Does anybody in the room know? Have any insight? Okay. With that, I can flesh that out on my own time, but I'll get the bill out of committee.
Okay. All right. Well, I'm happy to sign off on this. I had a student in my district that was not able to finish her rotation because of this vaccination requirement, and I find that it's a shame. I think COVID has revealed that we need to have a paradigm shift in our healthcare institutions regarding these kinds of medical mandates. They're really a violation of the fundamental rights that are expressed in the Fourth Amendment, that a person has the right to be free from unreasonable searches and seizures. I think that falls under this. This is an unreasonable seizure of a person's body or health, in my view, and it should be protected from government and from a private individual and business interfering in those decisions. So that's why I brought this forward, and I'm happy to move it forward. So I'll be signing off today. So with that, this meeting is dismissed.
Senator Green, can you speak specifically about lawsuits because I don't know of any?